Okay, picture this. You're an astronaut. You're years into this incredible mission. Maybe you're heading to Mars, humanity's next big step. You trained, you've endured, and then things start getting fuzzy, literally. Your vision starts to blur.
Yeah, it sounds almost trivial compared to, landing on another planet, but it's a massive challenge. We think about the rockets, the engineering, but we often forget how profoundly space affects the human body.
Especially our eyes, right? That's what we're diving into today, how the weirdness of space, particularly microgravity, messes with astronaut vision and even their brains.
Exactly. It's a condition called SANS, Spaceflight-Associated Neuro-Ocular Syndrome. And it's not just a minor niggle, it's a serious health risk for any long trip, like going to Mars.
So our mission today is to unpack SANS, look at other eye problems, astronauts face some pretty serious ones, and explore how we're trying to diagnose and fix these things, up there.
And it's fascinating because figuring this out isn't just about space. What we learn has real implications back here on Earth, too. It's all about this deep connection between gravity, how fluids move in our body, and sight.
Let's get into SANS then. Spaceflight-Associated Neuro-Ocular Syndrome. You said it's a big risk. How common is it?
It's surprisingly common, actually. We're seeing it affect at least 70%, maybe more, of astronauts who spend 6 months to a year up on the International Space Station. So yeah, a major issue.
70%. Wow. Okay, so what's actually causing it? You mentioned fluids.
That seems to be the key. See, here on Earth, gravity is constantly pulling your body fluids down. Your blood, your cerebrospinal fluid, the CSF around your brain and spine, it all behaves predictably.
Right.
But in space, without that constant pull, everything shifts. Fluids redistribute upwards towards the head. Astronauts get that puffy face look. That's part of it. It's called the cephalid fluid shift.
Okay, puffy face, I get that.
Yep.
But how does that affect the eyes?
Well, that fluid shift increases pressure inside the skull, intracranial pressure. And that pressure doesn't just stay in the skull. It seems to push on the back of the eye, transmitting pressure through the optic nerve sheath.
The sheath.
Yeah.
That's like the protective sleeve around the nerve connecting the eye to the brain.
Exactly. So you get pressure building up right where that vital connection happens.
Okay, let me wrap my head around this. It's like
Yeah.
your body's plumbing system suddenly doesn't have gravity helping direct the flow, so things back up towards the head, putting pressure on the eyes.
That's a good way to think about it, yeah. And the consequences aren't just like slightly blurry vision, though that happens, difficulty reading, problems with distance vision, contrast sensitivity loss. The pressure can physically change the eye. We see swelling at the optic nerve head. That's called optic dysedema.
Right.
We see the back of the eyeball actually flattening slightly.
Flattening. The eyeball changes shape.
It can, yeah. Posterior glow flattening. And they can develop these things called choroidal folds, wrinkles in the layer under the retina. Astronaut Michael Lopez Alegria, for instance, became more farsighted after his mission. It was like adding 10 years of aging to his eyes in just 7 months.
That's kind of terrifying. And it affects the brain, too.
It seems so. MRI scans have shown brain changes, too. The fluid-filled ventricles get bigger. The brain itself can shift slightly upwards. Even the pituitary gland shape can alter. It really highlights how finely tuned we are to Earth's gravity.
Do these changes go away when they come back to Earth?
For many astronauts on, say, typical 6 to 12-month ISS missions, yes, a lot of it reverses. They might need glasses temporarily. But some things, like those choroidal folds or the farsightedness, can stick around for months, maybe even years, possibly permanently.
So it's dose dependent. The longer you're up there.
The bigger the risk and the higher the chance of lasting changes. Exactly. That's the major concern for a multi-year Mars mission.
Okay, so SANS is this slow, creeping, internal change driven by fluid shifts. But space is trying to get our astronaut eyes in other ways too, right? More immediate threats.
Oh, absolutely. SANS is just one piece. There's a whole range of other, let's call them red risk eye conditions, things that are much trickier to handle in space.
Like what?
Well, the most common reported injuries are actually surface problems. Corneal abrasions, scratches on the eye surface, and foreign bodies getting lodged in the eye. We've logged about 70 cases.
70. What's causing those?
A few things unique to space. Think about dust. We learned from Apollo that lunar dust is sharp, really abrasive. Martian dust has perchlorates, which are also irritants.
Right.
And even inside the spacecraft in microgravity, tiny particles don't just settle. Bits of debris, maybe from equipment or even clothing, just float around. An elastic cord snaps back near your face. It's a constant hazard.
And I guess you can't just blink it away easily if gravity isn't helping clear things out. Plus, diagnosing a tiny speck without a proper eye doctor's microscope.
Exactly. You need specialized equipment like a slit lamp, which isn't always practical or available. And just the environment itself can cause dry eyes. Blinking patterns change, sensation changes, plus the floating particles. It all contributes. Apollo crews needed loads of saline drops just for the dust.
Okay, dust and debris. What else?
Infections are a worry. Corneal ulcers. Risk factors include contact lens wear, maybe getting a small scratch that gets infected using contaminated solutions. Plus, the immune system itself seems to change a bit in space, and microbes might even grow differently.
Oh, great. Superbugs in space.
Well, maybe not superbugs, but definitely a different environment. Then there are chemical burns. Accidental exposure to things like, well, even prolonged CO2 buildup could be an issue because air doesn't circulate the same way. Propellant leaks have happened. Formaldehyde off-gassing from equipment.
And trying to flush an eye with water and microgravity must be messy.
Extremely difficult. Water doesn't just flow down, it blobs and sticks. Getting the large volumes needed for a proper chemical burn irrigation is a huge challenge.
This is sounding worse and worse. What about more serious trauma?
Thankfully, we haven't seen really severe cases like a penetrating eye injury or the orbit being fractured, but you have to plan for it. A high-speed fragment from equipment, maybe during docking or undocking, it could cause devastating, sight-threatening damage.
And surgery is basically impossible, right?
One ISS, pretty much, yeah. The protocol for a penetrating injury is basically don't touch it, cover both eyes to stop movement, and hope for evacuation, which, on a trip to Mars,
isn't an option. Okay. What about inside the eye? Retinal problems.
that's another area affected by microgravity. The stress on the retina and the choroid layer underneath. We see oxidative stress, cellular changes, even thinning of these layers. It might make them more fragile, potentially increasing the risk of detachment.
Like the wallpaper peeling off the inside of the eye.
Kind of, yeah. And then there are vascular issues. Blockages in the tiny arteries or veins in the retina. The risk seems higher because of metabolic changes and the fact that blood actually tends to clot more easily in space, hypercoagulability. We even saw the first case of a deep vein thrombosis, a blood clot, in an astronaut's neck vein on the ISS.
A blood clot.
Yeah.
In space. Wow. Okay, and overlaying all of this is radiation, especially for deep space missions.
That's the big one for trips beyond Earth orbit. Once you leave the protection of our planet's magnetic field, you're exposed to much higher levels of galactic cosmic rays, GCRs.
And those do what to the eyes?
Long term, the biggest risk is cataracts. That's the most common radiation-linked effect. But it can also cause corneal damage, inflammation like conjunctivitis or keratitis, retinal swelling, even damage to the optic nerve.
How much radiation are we talking?
A Mars mission, maybe 2-3 years total, it's likely to push astronauts over NASA's current career radiation exposure limits. We're talking maybe 40-50 times the background radiation level we experience on Earth per year, compressed into that mission time.
Yikes. So sands, dust, chemicals, impacts, detachments, radiation. It really feels like space is actively hostile to human eyes.
It presents an unprecedented set of challenges, absolutely. We need ways to diagnose and manage these problems far from home.
Which brings us to diagnostics. How do they actually check astronaut vision up there right now?
A lot of it relies on telemedicine. Astronauts fill out questionnaires about their symptoms, blurry vision, headaches, that sort of thing. They do standard eye chart tests, Amsler grids for central vision, often with someone on the ground actually controlling the software remotely.
So mission control is giving the eye exam.
In a way, yes. They also guide the astronauts through using specialized cameras, fundoscopes, to take pictures of the back of the eye, the retina, and optic disc. That's crucial for monitoring SANS.
Okay. What about other tools?
Ultrasound is a big one. Astronauts scan each other, again with remote guidance from experts on Earth. It's good for measuring eye dimensions, checking for lens dislocations, or even retinal detachments.
But maybe not great for seeing a tiny scratch on the surface.
Right, it has limitations. It's not ideal for surface issues, and you wouldn't use it if you suspected the eyeball itself was ruptured. They also use OCT, optical coherence tomography.
OCT, that's like a super high-res scan.
Exactly. It gives incredibly detailed cross-sectional images of the retina, measuring nerve fiber layer thickness. Primarily used for SANS monitoring, but they're getting clever with it, using it with special training to look at the front of the eye too, the cornea and angle, for things like abrasions or ulcers.
So we have some good tech up there, but it sounds very reliant on Earth support. What happens when Mars is, 20 minutes away by radio signal minimum?
That's the crux of the problem. We need diagnostics that work asynchronously without that real-time back and forth. Astronauts need more autonomy.
So what's coming down the pipeline?
Well, simpler things first, like using fluorescent dye strips. You touch it to the eye, and it highlights any scratches, dry spots, or irregularities under a blue light. Basic but effective for surface issues. Then there's portable imaging. Handheld slit lamps, miniaturized versions of the eye doctor's microscope that are lightweight and allow quick checks for tiny foreign bodies. Many have cameras to send images back when possible.
Like a smartphone attachment.
Some are. There are advanced handheld retinal imagers, devices like the Paxoscope or DI that can even attach to smartphones. Some have built-in AI to help assess image quality, making them less dependent on immediate feedback.
Ah, AI. That seems key for autonomy.
It really is. AI and machine learning are huge areas of development. Imagine software that can automatically analyze those OCT scans or retinal photos, flag potential problems like SANS progression, glaucoma signs, maybe even early diabetic retinopathy changes without needing an Earth-based expert in real time.
So the goal is to make the astronaut more like their own eye specialist with AI backup.
Essentially, yes, empowering them with sophisticated tools that don't require constant hand-holding. It's about building a whole new way of doing medical care in deep space.
Okay, diagnostics are getting smarter. But what about treatment? If they find something, what can they actually do about it up there? The toolkit must be pretty limited.
It is very limited. For medications, they have some basics. Numbing eye drops, but the main one, proparacaine, needs refrigeration, which is a huge issue for long shelf life on a Mars mission. They have people dilating drops, artificial tears, lots of those, hopefully preservative-free, and a couple of standard antibiotic drops for bacterial infections.
What about viruses? Like a cold sore on the eye?
They might carry something like vidarabine for herpes infections, but even that can be toxic to the eye surface itself, so options are few.
And procedures, if they get that scratch or foreign body.
For a simple abrasion, gentle flushing with artificial tears. For a loose foreign body, maybe trying to carefully remove it with a moistened cotton swab. For chemical burns, the instruction is copious irrigation with whatever water they have, drink bags. Emergency eye wash, then use fluorescein to check the damage, and specific drops.
But for that really bad trauma, the penetrating injury.
The rule is strict. Do not remove the object, lightly cover the injured eye, patch the good eye to limit movement, and prepare for evacuation, which, again,
is impossible.
Yeah.
So treatment is basically first aid and hope for the best.
For severe things, unfortunately, yes. And even applying eye drops is harder in microgravity. An eye can only hold about 1 drop at a time, and getting it in without it floating away takes practice. Plus, the remote medical support is usually a general flight surgeon, not an ophthalmologist.
It really highlights prevention then. What can be done to stop these things happening in the first place?
Protective eyewear is paramount. Goggles during cargo transfer, suit maintenance, anything that might kick up dust or debris. They need to be lightweight, wrap around, maybe have special lens tints.
Makes sense.
Maintaining good ocular surface health is key too. Maybe nutritional supplements like fish oil for dry eye research is ongoing. And just using those preservative-free artificial tears frequently for lubrication, like the Apollo crews learned with lunar dust. Regular checks with fluorescein could also catch surface problems early before they get bad.
Okay, that covers the immediate threats. But what about the big one? SANS. How do you prevent the fluid shifts?
That's the multi-billion-dollar question, really.
Yeah.
The most talked-about solution is artificial gravity.
Spinning the spaceship, like in the movies.
Pretty much, yeah. Using centrifuges to create G-force. It works in animal studies, and human trials are starting. The engineering is immense, though. You need large rotating structures, potentially hundreds of meters across, to avoid making people dizzy or disoriented. Think rotating habitats, maybe 2 ships connected by a tether and spinning.
Wow. So recreating Earth gravity. Any less ambitious ideas?
There are. Lower bulky and negative pressure, or LBNP. It's basically putting the lower body in a vacuum chamber to actively suck fluids back down towards the legs, mimicking gravity's effect.
Like vacuum pants.
Sort of. They also look at diet and hydration protocols to manage fluid levels and pressure. And specific exercises, you might have seen astronauts on the ISS testing specialized cuffs worn on the thighs during exercise, designed to trap blood in the legs and counteract that upward fluid shift.
So thigh cuffs could help save your eyesight on the way to Mars. Incredible. And I think you mentioned Earth-based studies too.
Yeah, we use head-down tilt bed rest studies. People lie in bed with their head tilted down for weeks or months. It's not a perfect simulation of microgravity, but it's the best we have on Earth to study the fluid shifts, look for genetic factors that might make someone more susceptible to SANS, and test countermeasures like non-invasive ways to monitor intracranial pressure.
It sounds like we're throwing everything at this problem,
Mm-hmm.
from giant spinning spaceships to special socks.
It highlights the huge investment needed to keep humans healthy in space. We're trying to fundamentally counteract the effects of removing gravity. It's pushing the boundaries of medicine.
So let's connect all this back to the big goal, Mars. How critical is solving these vision issues for actually getting humans there and back safely?
It's absolutely critical. Think about a Mars mission. We're talking maybe 2-3 years total duration, much longer than an ISS stay.
Yeah.
And we know SANS is dose dependent. The longer you're exposed, the worse it might get, and the higher the chance of permanent vision changes. Can you imagine astronauts landing on Mars, needing to do complex work, operate equipment, potentially handle emergencies if their vision is significantly impaired? It could jeopardize the entire mission.
It really puts the vision in mission vision into sharp focus, doesn't it?
Yeah.
We need them to literally see clearly to succeed.
Precisely. It raises that question. Are we biologically ready for these ambitions? Or maybe this is the kind of challenge that forces the necessary innovation. The drive to explore is powerful, and that's why tackling these health risks head-on is so vital.
And interestingly, tackling these space problems has benefits right back here on Earth, doesn't it? It's not just about astronauts.
Not at all. The intense focus on how fluid pressure affects the eye and brain in microgravity gives us really valuable insights for conditions here on Earth. Well, think about glaucoma, which involves eye pressure, or a condition called idiopathic intracranial hypertension, IIH, where pressure builds up inside the head for unknown reasons, causing headaches and vision loss, often in young women. Understanding the fluid dynamics in SANS helps researchers studying these conditions.
Huh. I never would have connected glaucoma to space travel.
It's all about pressure and fluid dynamics in confined spaces, whether it's the skull or the eye. The research also helps understand optic nerve swelling from other causes, like trauma or disease.
And the technology. Those portable scanners, the AI diagnostics.
Absolutely. Those innovations developed for the extreme environment of space needing to be small, robust, easy to use, increasingly autonomous, they inevitably spin off into better, more accessible eye care tools for everyone. Imagine having advanced retinal screening using AI on a device connected to a smartphone in a remote clinic or even at home.
So trying to help astronauts see Mars clearly could end up helping my grandmother keep her vision longer.
That's exactly the kind of unexpected benefit we see time and again from space exploration. The extreme challenges force innovation that improves life here. It's a powerful feedback loop.
Wow. Well, this has been a truly eye-opening deep dive, if you'll excuse the pun. We've gone from the subtle, weird ways microgravity changes the body with SANS to cosmic dust, radiation threats, and the incredible tech being developed for diagnosis and prevention.
It really covers a huge range, from basic physiology to advanced engineering and AI. Hopefully it gives everyone listening a much clearer picture, couldn't resist, of one of the major hurdles for long-duration spaceflight.
It definitely does. It shows how much we still need to figure out, but also the amazing ingenuity being applied. So as we wrap up, maybe a final thought for our listeners.
I think it's about perspective. As we look outwards to Mars and beyond, these challenges force us to look inwards to understand human biology in ways we never have before.
Right. And that journey to understand ourselves, it's driven by the pull of the stars, ultimately brings knowledge and technology back home. So maybe the question to ponder is, what other unseen connections are out there, linking the grand scale of space exploration to the intricate workings of our own bodies?